has its ups and downs. Turn your pretty face into an ugly frown. Seems that when I fix one thing,
Hello, welcome to The Awakening. As usual, I'm your host. Today's show is going to be called Dentistry, and I have a wonderful doctor sitting across from me. His name is Dr. Shaivitz, and we've had a lot of fun before the air time came on, and I hope we have a hell of a good time right now. Welcome.
Thank you very much. It's good to be here.
Good to have. Oh, you still have cold hands.
I know.
You got a warm heart. All right, I know all about you.
Okay.
I think. My first question is, what put you on a path to being a dentist?
Well, when I was a young man, and I was
You're still a young man.
Well, thank you.
You're welcome.
Well, many years ago, when I was in high school, a sophomore, I was playing football, and I got hit in the mouth, and I had my front teeth knocked out, and I was just fascinated about how they were able to fix me and put me back together, and I just thought it was fascinating.
But how did you feel with your teeth knocked out? You certainly didn't feel fascinated about that.
No, it wasn't such a great feeling. My social life suffered because at the time I was walking around without front teeth, and we really couldn't afford to have new teeth put in. So I pretty much went around not smiling, and my social life at that time definitely suffered.
I'm sure. But there's a lot of ladies here in Bowie who walk up to me, like I said, a lot of the times, and they come to me and they show me their children's mouths. The kids' mouths are really bad now. They're missing like a front tooth, and the other tooth is coming in crooked, and they have gum disease, and so it's going to be a 30-minute show. I think I may not have to make it 2 shows, but I'm really into what you do because I'm into what people ask me.
Okay, great.
And what causes periodontal disease? The red puffy, what do you call it, Joe? Oh, your gums.
Right. Your
gums, and they're all puffy, and your mouth hurts. Because I know lots of small little kids talk to me about that.
Sure. Well, it's just that they just don't maintain good hygiene. It's just an accumulation of bacteria and plaque around the teeth that cause the gums to become red, swollen, and inflamed and bleed. And if it's just a matter of just brushing and flossing and taking good care of your teeth, there's really no reason for that to happen.
Do you believe in water picks?
Yeah, they're very helpful.
They're good, aren't they?
For some individuals, they're great. For other individuals, I don't recommend it because it can cause sometimes more damage than it can help.
How can that happen?
Well, if you have deep pockets, okay, and you have plaque...
Deep pockets in the gums.
In the gums, and you have plaque and bacteria in there, and then you take your water pick and you force that bacteria further down into that pocket, you can have something called a subcutaneous emphysema, which can force air down into your neck and throat region and cause even more severe problems.
More severe problems. I didn't know that.
Yeah.
I didn't know that.
So, I mean, it definitely is helpful for, let's say, children who have orthodontic, the braces. They can help clean that debris and plaque off. It's terrific.
Okay.
Yeah.
So you said what got you into dentistry was the fact that you got your teeth knocked out.
Right.
How long after that did you decide to go into dentistry?
I would say probably a year or 2. I just thought it was really neat.
Really?
And I thought, well, I need something to do. I really didn't have any direction at that time.
Right.
And I just decided that dentistry will be my field. So then I started taking those courses.
And you don't mind putting your hands on somebody's mouth every day, huh?
Well, you have to remember, I wear gloves.
I know you do. I know you do. But I think that's good that you do, because I know you do a good job. I can tell that you're a very honest doctor. I promise you, people, he's honest. Because I can really look at someone and I can size them up within a couple of minutes, and the eyes tells what goes on in the body and the soul.
Thank you.
You're good. You have a good soul.
Well, thanks.
And I would definitely come to you. I have a dentist right now. I've been with a long time, but if I get upset, you got a new client.
Well, it's great that you have a good relationship with your dentist.
You have to. Everybody, your gynecologist, everybody you can have a good relationship with.
I agree. It's all about relationships, and I've been seeing people for 20, 30, 35 years.
But you don't look that age. I told you that already.
Thank you.
We won't go there. So how did you feel when I picked up the telephone and said, Dr. Shaivitz, I want you on my show? Were you stunned or?
Surprised.
Surprised?
Yeah.
Okay.
Because I didn't expect anybody from out of the blue, calling. I know I do a fair amount of marketing.
Right.
And I think that's where you found my name.
I did.
And,
A card came in. It was a good-sized card.
Right.
It was pretty.
Right, thank you. And, you know, you can be the best dentist in the world, and if people don't know you're there,
Exactly.
you're not helping anybody.
Right.
So that's why I do,
Yeah.
you know, a good amount of marketing.
You're not out there just trying to sell yourself. You just want people to know you're there.
Right.
Right.
And there's tremendous things that we can do for people now, and it's wonderful.
Okay. How young should a child be before they go see the dentist for a checkup?
Generally, well, you know what? If the child is 2 and can handle it, that's great. But generally speaking, when they're 3 years old,
That's good.
that's a good time to start. Just to be exposed to a dentist, to go to the office, to see what the chair looks like, to
Take that little thing, squirt them with water.
Absolutely.
Make it a game.
Absolutely.
Yeah, and they'll love you.
And
I
just
think.
have fun.
Yeah. Because, like I said, my great niece is 9 now, and she let them take a tooth out of her mouth because she had a cavity in one of her teeth. So we've been talking to her a lot about that, but she's got her little automatic toothbrush. Are they good for children?
Absolutely.
Okay. And I have her use the water pick if her mouth, she can't get all the food out of her teeth or something. Because
great.
I don't like picks. You know, like you said, you could danger a gum
Sure.
and get an infection. So
Whatever is easy and whatever works and whatever is fun for kids, absolutely do it.
I think you have to make everything fun for little kids.
Sure.
Don't you have to do that?
Why not for adults too?
Okay. What do you do when you get a child in your office for the first time? How do you win them over?
I just talk to them.
Just talk to them? Okay.
Yeah. And just, you know, I think I can relate to them better now that I have grandchildren.
Oh.
And I know some of the programs I like to watch. They like my grandson loves Thomas the Train. So I
does
ask
my great niece Keely.
So,
yeah.
you know, I talk about Thomas the Train, and I talk about things like that they can relate to. And all of a sudden, you know, we're talking and we're friends. And I try not to even bring anything up about dentistry.
That's good. Yeah. That's good. And they'll learn from that too. They won't be afraid.
Yeah.
Well, you'll always be there, hopefully, for another 50 years.
And
you can take care of them.
I hope so.
So where is your office, basically? We won't give an address out. We'll just see here at Bowie.
We're in Laurel, Maryland.
Laurel, okay.
Yes. And we've been there a long time. I've been there since 1974.
Okay.
And it's been a great experience. It's a great community. The people have been wonderful to me, and I've really been enjoying it.
Do the parents have a job? This is one question I want to ask you. Should they get their children prepared to come to see you?
Sometimes it's better not to say anything other than just say that, you know, we're going to see somebody and we're going to go have your teeth polished. And we're going to, you know, and just show them we're going to have your teeth brushed. Sometimes the parents' own fears are conveyed to the children if they start getting into it. Don't do too much.
Okay.
Let the professional handle it. Let the dentist handle it, and they'll do fine.
And you've been practicing for over 30 years?
39 years to be exact.
39 years
Yes.
to be exact.
Yep.
And you seem like you're so happy about doing it as you did before you probably got into it.
I look forward to it. To me, at this point in my life, it's my hobby, or it's one of my hobbies.
Okay.
So, you know, I enjoy it. It's fun. I have a wonderful staff. They make my life easy, and I enjoy just being with people. It's a fun way to spend. To me, it's a fun way to spend the day.
Now, do you have all ages of people?
When children are really young, sometimes it's best that they're seen by a pedodontist, a children's dentist. When the children are 3 and 4.
I've never even heard that word before.
Yeah. It's a pedodontist, and it's a specialty of dentistry that takes care of young children, adolescents, and sometimes children with special needs.
Okay.
And they're wonderful. We have one right across the hall from me, and he's my age, and he's wonderful. He has great patience. I could not do that.
Right.
I really couldn't.
It would be very difficult. I have a niece who has Down syndrome, and she's 24 now, and she still has a hard time with things. So. Well, we're not going to have a hard time here.
No.
And we've already covered the fact that you really do love what you do.
Absolutely.
And 35 years.
It's been great.
Whereabouts are you located here in Bowie?
Oh, no,
You're still in Laurel.
I'm in Laurel, and I live in Baltimore. So you know.
Is that a long trip for you?
Well, I leave early in the morning, so from door to door it takes me 35 minutes.
That's wonderful.
Yeah.
That is wonderful.
I'm an early riser.
You're an early riser?
I hate to admit one thing though, that I get into the office by 6:30 every morning, and sometimes when people call early, they go, "What are you doing there?"
Yeah.
Well, you know what? I do my paperwork, I do my lab work, and I enjoy it.
What procedure do you mostly do?
I would probably say the most, well, it would be crown and bridge work. Caps.
Crowns and
yeah, caps.
What's a cap?
Well, it's when you have to reduce the tooth and place something over. It's the same as a crown or a cap where you have to restore the tooth by placing it, a tooth that looks just like a natural tooth over top of it.
Oh, okay.
Yeah.
How do you make the thing stay in your mouth?
Well, by preparing it properly
And gluing it?
and then bonding it in or cementing it in. And the
they
cements
And
now,
they last?
well, I would say, most of my work has been in 30, 35 years. I have crowns that have been in 20, 30, 35 years or more. And,
Really?
Yeah. And, I don't like to tell people, well, you say they're permanent. That means they're fixed. They may not last a lifetime, but if you look at the literature says that the average crown lasts anywhere from 7 to 10 years.
Really? That's good.
Yeah.
That's very good.
I always kid with my patients when they've had the crown for 30 years. I say, I don't think I charged you enough.
They'll probably say, well, now the cost of things, no, you didn't. What are some of the things that young children should not bite down on? Like a hard piece of peanut? A hard piece of candy, like hard candy? I know kids with lots of, like the lollipops, Tootsie Roll Pops, put that in it. What would happen? I know what would happen, but...
Yeah. Well, I tell them to stay away from hard candies. Do not chew ice. That can break teeth.
Yeah.
Yeah, that's probably one of the worst things they can chew on. And stay away from real hard candies. And that's pretty much it. Everything else is pretty much tolerable.
And do you have really good, I'm sure you have a good rapport because we've got a great one here. You have a good rapport with people, I'm sure with children too.
I think
They
so,
don't come in
yes.
there crying and screaming.
No, but
We're going to see Dr. Shaivitz today. Is it okay? Oh, screaming,
No, you know what? If you just sit and talk to them and relate to them on their level, they're fine. And you just be honest with them. I mean, if you're going to do something and something's going to pinch, I say to them, well, give me your hand. And I'll pinch their hand and I'll say, that's like a mosquito bite. You may feel that in your mouth.
You mean with a needle?
Yeah. But
Oh, that
usually
needle
now,
is scary even for me.
well, you know what? There are newer techniques now that we use a vibrating instrument that when you give them the injection, you vibrate and they feel the vibration and they don't feel the injection.
They don't feel the prick.
And
I'm scared of that myself.
Well, there are really great techniques. There's also new topical anesthetics that are varnishes that you put on. And I'm impressed with them. And I've recently been using them, I guess, for probably about 3 or 4 months now. And people don't even feel the injection. It's really wonderful.
So it's something that numbs your own gum.
It numbs your gum before you get an injection.
And then before you put the needle in.
Yeah.
Pretty soon there's going to be easy everything, isn't it?
It's amazing.
It's amazing, yes.
Dentistry's come a long way.
Well, tell me about some of when you first got started. The old-fashioned. Yeah, I want to touch a little bit on the old-fashioned. We've talked a lot about the new.
One thing is, we used to take impressions. If we have to make a crown, we have to make an impression. And we used to have to mix these two materials that were disgusting. And then we would put them in the mouth, and they would taste like sulfur. And they would have to sit in your mouth for 8 minutes.
Oh, my.
Now, all we do is, it's already pre-mixed. All we do is syringe it out, squirt it out, and we put it in the mouth for maybe 3 minutes with a tiny little impression, not a huge impression. And the materials are so accurate that it's amazing.
Really?
Yeah, it's wonderful. To me, it almost doesn't seem real that you can make an impression and have something put in the mouth with such amazing accuracy.
So it's amazing for you just how much, it's probably amazing for all of us who go, I have not your patient yet, but I mean for the other ones who do come, it's probably amazing. They don't have to sit there that long.
A lot of times after a procedure, a patient will say to me, is that it?
Yeah, are we done?
And I'll say, yeah, we're done. And they say, that wasn't bad at all. I said, yeah, I know. Things have improved a lot.
I know several dentists right here in Bowie, which I'm not going to say anything because I don't want to be sued. But as soon as you walk in the door, the first thing is done. They take you into a little room. What do you want done? And they start calculating the money.
Well, you have to listen to what people want.
Yeah. But I mean, you haven't even seen the dentist yet.
Right. Well, see, that's...
So you just get up out of your chair and you think you're going, but you're going to go in their office and they're going to tell you. You tell them what you want to do or what you'd like to have done, and they want to know how much is it going to cost? How are you going to pay for it? Do you want to charge it? Do this? Do that? That's not business.
Well, I think before you start to do something,
yes.
I think before you even get into that, you have that rapport. And you decide what's going to be the best treatment for that person.
Right.
And then you say, well, these are the different possibilities. You know, if this is something you want, we can do this. This is something you want, we can do that. Then tell me, is this something you want to invest in? If you want to invest in that, that's great. If not, we'll do the bare minimum, and that's fine too.
Yeah.
You know, you have to give people what they really want, but you also have to educate them and tell them what's available.
But when you go walking in there, because I know it's happened to me once, twice, and you know, you'll go to a doctor and well, this tooth hurts me, you know, and I'd like to have this done. And they'll say, well, okay, let's see how much it's going to, do you have health insurance? Right away. Dental insurance? I get so mad, you know. Even if you don't have dental insurance, I'm sure you have money if you're not going to go see a doctor and rip him off. You know what I'm saying?
Sure.
And they're shysters. I'm sorry, but I'm very honest on this show. They are shysters, and I don't want to be around people like that.
I don't blame you. There's good and bad in any profession, in any
and
business.
I won't mention their names because they'd get a good chunk of change out of me, and I wouldn't give them that satisfaction.
Well, you're smart.
But to be told before, well, this is going to cost this and this, and you just, oh, how am I going to pay for that? Where am I going to get the money at? I can't afford this. So I know of people, because I did it.
Sure.
You just open the door and you walk out. I don't need somebody to bombard me like that for money.
You know, sometimes you're just not a good match with somebody else.
Yeah, yeah.
And that's fine.
Yeah, that's okay. But, you know, I think it's like you said, go in, see the actual, you know, the dentist, orthodontist or dentist, and sit down and talk about this.
Absolutely.
And then find out, after you get all of the pros and cons, then you decide if you're going to put that money in there or not. But don't be told you got $5,000 bill and you haven't even talked to the doctor yet, you know?
No, that's not right. You need to find out what that person wants, what's important to them, what their needs are. You know, there may be medical issues that preclude the fact that you can't do certain things.
Yeah.
So,
and I think you should have your health evaluated.
Oh, absolutely.
If you're heart trouble or high blood pressure or something like that, and you know who you are out there. And I mean, it's very upsetting. It was upsetting to me, and I've since learned it's a lot of other women who've gone through the same thing.
Oh, I'm sure.
Yeah.
I'm sure.
So.
Well, you know something, in dentistry, we're very lucky in that we generally see people like twice a year or 3 or 4 times a year.
Yes, every 6 months or so.
Right, and you do some screening. You look at their mouths. You can tell if they have maybe pre-diabetic. You can do blood pressure.
How can you tell if you're pre-diabetic? That's a good question.
Okay, you can look at the quality of the tissue and get an idea how many teeth are missing, what condition are the gums in, and that can give you a pretty good idea what the blood sugar can be. A lot of times we'll find that a person is diabetic or pre-diabetic before we do anything by just talking to them and examining them and then referring them to a physician to have blood tests. So in that respect, as dentists, we're like pre-screeners. We can screen people and get a pretty good idea if they're really healthy or not healthy.
That's really good. That's good. So you can do that as well as put a tooth in their mouth.
Sure, absolutely.
Because I've often wondered if you go in and just get a plain cap put over a tooth, if that thing starts to jiggle and jiggle, you are going to get periodontal under your gums, and then you're going to spread it to the next tooth and the next tooth.
You know, when somebody says, I want this done, I'd say, well, you know, the first thing we have to look at you and see if you're healthy. We have to look if the teeth or if the gums are healthy, if you can have a crown. Then we take x-rays to determine if the nerves are healthy, if the bone is healthy. You know, we're not treating just a tooth, we're treating a human being.
You're treating the body.
Yeah.
Yeah, because it all goes together.
Yeah, so you look at them, the overall picture, and then you discuss, okay, are there any medical issues that we have to be concerned about? So, you know, it's just not, we're treating teeth, we're treating a person. And we can make them, give them, you know, we can add to their overall good health.
Well, I've had my sister she's not going to come on the air with us, but what happened to her, she got a cavity once in a tooth, and the doctor filled it and didn't do it right. So then he said, we're going to have to make a bridge. So then they take out another tooth and they put in a piece of bridge. Now, my sister wears upper and lower bridges.
Oh, that's a shame.
Because each tooth has done something to the other healthy tooth, and that healthy tooth has taken away the other healthy tooth, and you end up like that, and that's very, very sad.
It's a shame.
It really teases me off when that happens.
It upsets me when I see, you know, sometimes the questionable dentistry or somebody who hasn't done the right thing for somebody. It's very upsetting. It gives dentistry a bad name. But, you know, thankfully, I think most of us really try to do the best job we can.
Yeah. You can read the person. My sister can't do that. So from now on, when she wants to do things, I like to go with her.
That's a good idea.
I'm not a psychic or I got my own little ball. I can just rub it and it's going to tell me. But I can see into people. You are a very honest person. I can see it in your eyes. And I'm not some, you know, crazy lady. But, I mean, you are very open and honest. And I like that about you.
you know something, there's so much work that needs to be done. You don't have to make up anything.
Yes.
And I know there are, I've heard of people that have done that.
Yes.
You can do, there's so much good you can do, just taking care of what people's needs are.
Well, I have a doctor who always wants to be paid before I even get on the table, and I said, no. When we're all done, then you can give me the bill. But he's a wonderful doctor. He's been my doctor for about 20 years, so I trust him with my life.
That's wonderful.
But he still says the same thing, so I don't care about that. So I would say your practice is pretty mixed up then. Adults, teenagers, young children, starting at the age of 3?
Yes. It's probably one of the most diverse practices I've ever seen. You know, and the different types of people, from people who don't have much in the way of means to very wealthy people to people from all different walks of life, from different countries, different languages.
Really?
Yeah, it's fun.
That's great.
Yeah.
So everybody knows you then?
I don't know about everybody, but
Well, that's a good chunk of us know you.
well, if you've been around long enough, eventually people find out who you are.
That's good. But they also, what you've done for them, they can spread the word around that you're good.
They've been very kind to recommend me to their friends and family.
Right.
Yeah.
But I know a lot of friends of mine I'm going to be sending to you because they have trouble with their mouths like that.
Oh, great. I'd love to help them.
Yeah, and I mean, I'm not into implants. I do have 2 in my mouth right now, and I wish if I could take them out and never done it, I would do it. But the point is they're there and they're okay right now. But I've had problems with those things. I really have.
I'm sorry you have.
Yeah.
I mean, usually they're really a problem-free procedure. I mean, and like anything, you know, you have to maintain it. But I'm sorry, people, I hear that sometimes. People say, I've had an implant and I don't want to do it. But there are some really great people who do beautiful implants and the work is wonderful.
Well, when I was about 15 years old, I took a fall, something like you, and I broke off 2 of my front teeth. And I did not want to walk around looking like that, you know, no 2 front teeth. Like that song, All I Want for Christmas, All I Want for Christmas, my 2 front teeth. And the doctor started out by making a partial. And what happens is it wears.
Sure.
It rubs right up and down. It runs in the ridges, then you lose a tooth. Then on the other side starts to rub, and then you lose another tooth. So you have to have a very good surgeon, you've got to be a bunch of things. I mean, you're a good dentist, I can tell that, okay? And I believe what you say, and that's a good thing for you.
Well, you have to be a good psychologist because you have
Well,
to
I have
know
a
who you're
degree in
treating,
psychology as well.
which is really helpful.
But I can, like I said, I can read eyes, and I can also go in. One day I was in my dentist's office that I won't mention his name, and this lady came in and was telling me, well, I lost this tooth, and I had to have one replaced. I did this. But I hear this doctor's really good. I said, take it from me, lady, he's not. She was out the door before he even called her name. But, you know, I have a big mouth, and I try to spread the word that when I know things, I don't, you know, just go out looking for trouble. But I do try to help.
You know, the best referral is a word-of-mouth referral because
Exactly.
you're telling somebody about your experiences, and there's nothing more accurate than that.
Yeah. So what category would you say is your most like patients? I know a 3-year-old would be a little, you know, you can be itchy, you know, wanting to sit still.
Well, as a prosthodontist, I see more mature patients.
Okay.
People who need 1 tooth or multiple teeth or even all their teeth replaced. So, you know, that's most of my work is more of a mature audience.
Okay, now if you have someone who comes in and they're going to have a large bill with you, can they pay you in payments?
Yeah, we have a lot of different ways to pay.
Okay.
And we try to do as many things that are easy for people. We have different, we take credit cards, we have different payment programs.
What about that Care First program you have?
It's Care First is excellent. Actually, a lot of our patients use it because, you know, they say, well, I can pay you over a 12-month period,
With no
interest-free.
interest, yes.
Yeah, it's wonderful. Yeah, and so it's taken care of. They don't have to worry about it. They can fit it into their budget, and it's really nice.
And people really need to look after their mouths.
Oh, absolutely.
But right now, some of these people are going to say, well, what does she know? You know, she's working, I'm not, you know. But I do. I worry about people who don't have work. You know, I try to take food to the people I know who need it.
Oh, that's wonderful.
And same thing for the animals and for the children, especially the babies, too. So there's a, you know, we've got to grow up in a country where we help each other.
Oh, absolutely. I agree.
But yeah, you have a job, and like I say, my gynecologist is funny. But, you know, you've got to make little turns here and there.
We're all helping one another.
That's what I'm looking for, helping. You know, you've got to help one another in order to have a better, safe life.
Oh, absolutely.
Right.
I think this is a pretty great country.
I do too. I like it. I like it.
I think that's the best of the best, and we're actually the most charitable country in the world. And it's wonderful what we do. And when people really need help, I think we usually get it.
We usually do. I remember last Thanksgiving, I went through Palmer Park with a whole carload of hams. And I felt so excited because I was giving food to people who didn't have it.
That's wonderful.
You know, Thanksgiving, they don't have a ham. Maybe they'll have enough just for that, you know. But I'm always knocking on doors.
Oh, that's great.
It helps, you know. We've got to help one another. We've got to help one another. Our time is almost up. What would you like to leave my viewing audience with? What would you like to leave with them?
Well, I'd like to leave them with the idea that you're a great interviewer.
Thank you very much.
That you're fun to be with.
Oh, thank you.
And you've really made me feel very, very comfortable.
Okay.
And I appreciate that. And if I can leave anybody with the idea that, you know, that there are dentists out there that want to help you. And don't put things off.
Okay, don't put them away for a rainy day, right?
You know, don't put things off because things don't get better on their own.
That's true.
And I see people sometimes putting things off, and it just gets worse. And there's always some way, you know, in whatever situation you're in, there's always some way to help you.
To help get it done.
Yeah.
And well, okay, if I had a really bad aching mouth and I didn't have $1 to my name, I could call you up and you would see me.
Absolutely. There's always a way to.
There's always a way.
There's always a way.
Well, I'm glad I found you. I'm glad I got you on my show.
Well, thank
you
you.
are welcome back here anytime you
Well,
want to
thanks.
come.
I really enjoyed it.
And I've had so much fun having you here.
Thank you.
Thank you for being with me.
Thank you for having me.
Thanks for watching, and I hope you learned from this. Till next time.